All right, we should hear more about the extent of Lindor's injury after he visits a hand specialist tomorrow. So tonight we spoke to Dr. Daniel Polatsch, an orthopedic surgeon with Northwell Health at the New York Hand and Wrist Center of Lenox Hill. They treat a lot of pro athletes there. And Dr. Polatsch gave us some unique insights into why golfers and baseball players are prone to these hamate bone injuries and why he believes surgery is the best path.
Butt of the club or the bat rests right on the part of the bone called the hook of the hamate. And with repetitive use and repetitive swings, you can get a stress fracture. This particular bone has a horrible blood supply. So often it progresses to a fracture, which almost always doesn't heal. So that's why it's a big concern, especially in someone who's starting the season, and that's probably why they're worried. Often what happens is it goes on to not heal, and then in a pro athlete, you'd actually remove that fractured fragment of bone with a pretty predictable, great result. So the negative of waiting is that if he then rested for a period of time and starts swinging and it hurts, then he's already just wasted 6 weeks. Whereas if you perform the surgery predictably, you're not trying to get the bone to heal, which takes a lot longer. You're actually removing this small little hamate hook, and you can start rehab right away. Generally 6 weeks recovery, and you can feel confident that they'll be back. I remember I did one not that long ago, and at the 6 week mark or 7 week mark, I saw this person who's a high level golfer, and I said, how you doing? How's it feel? He goes, I have my 4th hole in one already. And I said, what? I've never even had one.
That can be said about the rest of us too, I think. Dr. Polatsch, thank you so much for your insight.